Namaste everyone. This is my class for you so that you can take care of your hip mobility. We'll start from sitting. Raise your arms up, interlock your fingers, stretch your arms up, lengthen yourself, raise up, hold it for a few breaths. Now place the right hand on the left knee, left hand goes back, spinal twist. Don't over twist. Come back again, interlock your fingers, raise your arms up, extend up, elbows straight, feel the vertical lengthening. Now left hand on the right knee, right hand back, twist. Breathe few times. Back again, interlock your fingers one more time, reach up, twist, right hand on the left knee, left hand goes back. Come back, stretch, and twist to the other side. And it is fine if you get confused in the sides. You can do any side because eventually you have to do it the other way as well. And then come back. If you have time, you can do a few more times. Otherwise, well, go ahead. Extend your legs forward. Keep the legs apart. And just move your feet in and out. You're focusing at the hip joint. So the thighs are rolling in and out. Don't lean back too much. Just stay upright. Keep breathing in and out. And now, start rotating your ankle. Big circles. You can do 8 to 10 rotation one side and then eventually the other way. Sometimes some exercises you will want to do more, so you can just pause the video and do as much as you want. All right, now bring your feet close to your hip. This is called butterfly position. I'll just turn this side so that you can observe. Back straight. If your back rounds, then move your feet away. All right, keep your spine straight and just bounce your knees. Start slow. And you need to feel the sensation at your hip, not at your knees. So though it looks like you're bouncing with the knees, but the action is happening at your hips. And it's fine if you don't go all the way down. If your knees are here only, it's okay. It's a matter of time. Okay, you can do like 20 times or more if you have time or if you wish so. And then extend your legs forward, shake your legs again. Now you can just pump your legs. All right, now make your way into all fours. Place your hands under your knees, knees under your hip. Inhale, extend your spine. We will do classical cat and cow. Exhale, round your back. Inhale, arch your back, extend your spine. Exhale, round your back. Inhale, arch your back. Exhale, round your back. Inhale, extend your spine. Exhale, round your back. Inhale, arch your back. Exhale, round your back. Inhale, arch your back. Exhale, round your back. You can do 8 to 10 times or more. And then you take the blocks in. And now place your right foot forward. Now place the blocks in a way that your spine is vertical. You're not leaning forward. All right? Now we'll do dynamic low lunges. So you move your hip back, and as you exhale, you just push your hip forward. Inhale. Exhale. Inhale. Exhale. Inhale. You can lower the blocks if you are going deep. Exhale. Inhale. Exhale. Inhale. And exhale. Inhale. And exhale. And once you have done 8 to 10 reps, you can just stay still. Just stay still into low lunge. You can lower the blocks. You can lower even further. Shoulders back, chest open. Don't let your spine collapse. Keep lifting. Hold it. And then quickly switch side. Take the right knee back, left foot forward. One more thing. Now I have a good cushion. I'm using 2 mats. But if you feel your knee hurts, or if you don't have cushioning and your floor is hard, take a blanket or a folded towel. Okay? Always give padding to your joints. Now take the blocks, push your hip forward. Again, the dynamic movements. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Do not lean forward. There's no need of putting the hands forward. Keep the spine straight. We are positioning ourselves in a way that we work on the hip. And after 8 to 10 repetitions, you just stay still and go deep into the pose. Shoulders back, chest open. Breathe long and deep. Stay calm. Let the brain relax. You can stay here. You can take 10 long, deep breaths. 10, 15, 20 breaths. And then move on. All right. Now we'll add on the element of twist into low lunging. All right. So now again, padding under my left knee. Now I don't need padding because I have cushioning. So I'll keep the blanket aside. But you use it. Now right foot forward. Again, lift the torso up. You're not leaning forward. Lift the torso up while you push your hip forward. Now inhale, raise your arms up. Exhale, twist. How you will twist? You bring your left hand on the outer right knee and right hand on the hamstring. And it is fine if it doesn't reach here. All right, just twist. Now inhale, raise your arms up again. Exhale, twist. Inhale, reach up. Exhale, twist. You can see with every breath I'm going deeper, but I'm not misaligning myself. Inhale. Exhale. That's the point. We want to go deep, but not to hurt ourselves. Inhale, raise your arms up. Exhale, twist. Now I'm doing just 5, and then you can stay in this low lunging twist. This feels really well, really good. Any twist, if you do it correctly, it feels really, really nice. Hold it for again 10 breaths. And then relax. Fantastic. The other side. Left foot forward. All right, inhale, raise your arms up. Exhale, twist. Right hand on the left knee, left hand goes on the outer right hamstring. Rotate. Feel the rotation coming from abdomen. Inhale, raise your arms up. Exhale, twist. Inhale, raise your arms up. Exhale, twist. And it is fine if you're not that deep. You can stay here, but still do the twist. Inhale and twist. You can go even further if you cannot go any further. Inhale, exhale. If you're very deep, you can go even deeper than me. It's fine as well. Inhale and exhale, twist. Rotate and hold. Spine straight. Feel this whole abdomen is rotating from center to the left. All right, now place your hands down, relax. If you need a break, you can sit back in what you call child pose or Adho Mukh Virasana. All right, moving ahead. Now, come on your knees. And again, I will remind you to use blanket. So stay left to the center so that you have more space on the right side. All right? Now, keep the left knee on the blanket, right leg out. Okay, so don't keep the right heel just under the knee. Keep it a little bit away. All right? Now, arms up, almost like you are doing warrior 2 with your knee down. Now, with inhale, you stay here. With exhale, you lean to the right side. Inhale back. Exhale. Inhale. Exhale. Inhale. What you don't want to squat back. You want to keep your hip between your leg. We have done 4. We'll do 4 more. Exhale. Inhale. You can even point your back foot. Exhale. Inhale. Exhale. I'm doing my right side. You can start with your left side, right side. You have only 2 sides. So whichever side you start, you have to do the other one as well. So it's fine. Now, just stay deep. Stay down. If your arm starts hurting, you can relax your arms. It's fine. Keep moving the hip. Though I look still from outside, but I'm still working within. I'm constantly trying to go deep, taking help of my breath. Breathe. You can again stay for 10, 15 seconds. Now, this is a big joint. Big muscles are working here. So you can hold longer. You can hold for 30 breaths. 1 minute, 1.5 minutes, if you have time. Or at least 20 seconds is good. All right, come back. And now switch. Other side. Left leg out. Again, I'm aligning my right knee with my left foot. Hip is stabilized. The heel is slightly ahead of my knee. Arms up. Inhale. Now exhale deep. Inhale. Exhale deep. You can see my left hip not as mobile as my right. That's okay. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. 3 more. Inhale. Exhale. Inhale. Exhale. 1 more. Inhale. Now exhale. Stay here. Shoulder relax. If your arms are up, don't shrug your shoulders. Shoulders are relaxed. Arms straight or place the hands down. Keep the hip forward. Don't sit back. You can go deeper by sitting back, but you're defying the purpose of doing this exercise. Stay here for 20 to 30 seconds or more. All right, now again move to your left side and place your right foot out. Now slide your right foot out, keep the foot flat, place the hands forward. Now, if the foot is on the floor, it's easy to slide. So let the foot slide on the floor. I might be going out of the frame, but you understand what I'm doing. So move the right foot as far as possible. And if you see my left toes on the back, it's facing the other side. But see, these are also dependent on your current mobility. So if it's not happening, just adjust yourself like that or ask me what to do in particular cases. All right, so my left knee is stable, my right foot is sliding out. I'm staying here. Breathe. Breathe 3 to 5 times. And then I come back. Come back not all the way back, but just to ease from the pose. Take a few breaths here. And go again. So every time you will go back to the same pose, you will go a bit deeper. So you can see the foot has gone a little wider than the first time. Now, what you can do, you can also place the forearm. Again, my elbows, I don't want to put my elbows directly. So I will use my blankets. But let's hold this for a few breaths and then come back again. So I'll repeat this 3 times. And on the 3rd time, I will hold longer. Okay, now I'm relaxed. Take a few long and deep breaths. And move. So this is an intense pose. So I don't want to push myself to maximum depth on my first round. So that's why I'm taking 3 rounds. You can take 5 rounds also. Now, I would like to go deeper. So I place my forearms down. My right foot is absolutely flat. My right knee is straight. Shoulders are relaxed, spine is straight. I don't want to push myself to put my elbows down. So if your elbows are not reaching down, it's fine. You can stay here. As long as there is sensation in your hip, you know you're working on your hip mobility, it's fine. All right, back off. Take a few breaths. And now we'll go to the other side. Again, left side is tighter, so I don't enjoy it so much, but it's fine. You have to do it. Left foot out. You can start here and slide, or you can start with placing your hands. Slide the foot out. Right toes are pointing out as well. The legs straight, foot flat. Back straight. Breathe 3 to 5 times. Long and deep breath. And come back. Relax. Let the hip joint relax. And then slide again. You can see my hip is going down. Back again. 3rd time, we'll stay longer. And slide. Forearms down or not, it's fine. I'm careful for my joint because I got an injury in my elbow a few months back and it took me 2 months to recover from the pain. So I don't want that to happen again. Stay here. Now, when you're holding the pose and there is no one to lead you, if you're following me on YouTube, if you're practicing with me, it's fine. But if you're practicing by yourself, you can use a timer or you can observe the breath. So the idea is to keep the duration same on both sides. You don't want to hold longer on one side and hold less on the other side. And it always happens because we all start with the right side, and by the time we come to the left side, we don't want to hold longer. So just we finish left side quicker. So you don't want to do that. All right, moving ahead. Relax the legs again. But that was an intense stretch. So if you want to take a pause, take pause. There's no rush. Now the next segment is 90-90. So 90-90 is you extend your legs in front, then you bend your knees in a way that your shin bone becomes parallel. All right, the toes are pointing back. Try pulling your feet back. All right, spine straight. Of course, if your spine is not straight, you can keep your feet forward a little bit. Spine straight, toes are pointing, and feet are supercharged, active. Your feet are not resting. They're charged. They're active. All right, keep the back straight. The easy variation is you keep your hands back, and now right knee goes in. Then right knee comes up, left knee goes in. Then left knee goes out, right knee goes in. Now, if you want to make it strong, hold your hand like this and keep your spine straight. Move side to side. So you're doing internal and external rotation of the hip. Very nice exercise. Do it like 8 to 10 times both sides, and then hold the right knee down. Inside, left knee is also down, but it's outside. All right. Now what you do, keep the left hand on the back. Hold the right hip at the top. So you trace your thigh bone and hold the top of the right thigh bone. This is exactly where my pocket is. Okay, you hold it. Now, charge your right foot, activate the right foot. Now, exhale, lift the right foot up. Inhale. Exhale, up. So this is internal rotation. Down. Up. Down. Up. Down. Again, 8 to 10 times. Up. Down. Up. So it looks like I'm lifting the foot, but what I'm doing, I'm rolling my thigh bone in. So this is internal rotation of the hip. You don't always do this. This movement is not normally done by anyone. So do it. Now hold it here, hold it here, hold it here. Now what you can do, just to increase the intensity, you can just keep your hands up and try to straighten your back. Hold it, hold it, hold it. Again, use the timer, because if you're counting your breath, you might start breathing fast because you don't like it, it's hard. And then down. All right, now the right knee goes up, left knee goes in. Adjust yourself, go back on your mat if you have slided out. Now hold the left hip at the top. Now just exhale, pick up, inhale down. Exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale. I forgot how many repetitions I have done, but I'll consider this as my last one. Lift and hold. Now, left hip is not that mobile, so I will not lift my arms, all right? I will keep my right hand down and focus more on depth of rotation. You can see my foot is still charged. And slowly relax. Done. 90-90 done. Relax. Shake your legs. Okay, we are almost towards the end. Now I'll give you two options. You can do seated pigeon or reclining pigeon. All right? So, seated pigeon. The right, so just check the edge of the mat. This is the front edge of the mat. So align your right shin parallel to the front edge of the mat, and then place the left ankle on top of the right knee. So if I turn this way, you can see my left ankle is above my right knee, my right ankle is below the knee. So both shins are parallel, and there is a triangle shape between the leg. All right? For some of you, this might be too much and your knee is here. So what you can do, you can slide this right foot down along the shin, or you can place the left foot forward. All right? So there are three variations. This is main, this is easier, this is even more. All right? Now, whatever you do, now I will just change because you have to take the reference of your mat. So now my shins are parallel to the front edge. Now you just lengthen your spine. You can see I'm creating space on my back, because if my spine is rounding, the sensation is not reaching to my hip. So I want my spine to be straight. Extend. All right, keep extending, shoulders relaxed, neck easy, neck easy. Keep extending. Elbows can come down. Again, this is well cushioned, so I don't need blanket. You can use the blanket. Now what I do, I push my elbows back into the shin and lengthen my back. Create space in my lower back. Now this is again a very pleasant stretch. It hurts, but you really like it. So, and this is also a position that you can hold for long. So 2 minutes, very good. 3 minutes, good. But I'll go to other side because I have to show you the reclining pigeon also. All right. So I will not go into the methodology. Now I'm just switching the side. My right hand on top of the left. Again, if this is too much and in order to put your elbow down, your spine rounds like this, it means you're going too deep. You can just stay here. Or as we had the block, you can also use the block. There's so many variations. If you're really sensitive towards your own body and if you want to take care of your body, why would you go deeper than what you feel right at? So just stay on your edge and don't over push it. So you can hold these stretches longer. You can pause the video, but you can also choose an option. Instead of doing seated pigeon, you can do reclining pigeon. So you don't have to do both. You can do either or. All right, so now the second variation, this is reclining. So the knees are bent, right ankle goes on top of the left knee. All right. Now again, there is a triangular gap if you can see here. All right, so my right hand goes into that gap and I hold my top of the left shin and then I interlock my fingers. All right, your right foot is active and just draw that left knee in. Now some of you, if you don't have spinal flexibility, you might feel your neck is pulled like this. So if your neck is pulled like this, you need a pillow. So you can use the blanket, the same blanket or the same block under. Any pose, whenever you do poses like this and you feel your neck is being pulled up, it means you need a pillow. Okay, then same, you can do the other side. Again, you can hold this as well for like a minute more. If you don't have time, you can hold it for shorter duration. And now, if you're laying down, you can do this laying down twist. You can place the right knee on top of the left knee, arms out. Shift your hips slightly to the right side and lower down your knees to the left. And you don't have to push yourself down. You don't have to lower your knee all the way back. What I do, I place a block here. And I work on lengthening my outer right hip down with my left hand so that I have space in my side body. And now I'm trying to rotate my abdomen to the right side, opposite to my knees. Turn the head, look at your right hand. Again, you can hold this for about 30 seconds or more. You can switch side. You can see better on this side. So left knee goes on top of the right. Shift your hips slightly to the left side. And I already placed my block here. So the block will support me and the knees go to my right side. Left arm open, the stomach revolves against the hip. You can choose any twist. I like this twist for me, but you can choose a simple twist. Like the simple twist could be knees up, drop, other side, or right foot up and drop the other side. Even if you had done seated pigeon, so the twist could be just the way you started. And the last, you can just come on child pose, hip back on your heels, reach forward. Relax here for a few moments. You can stay here for a minute. And by now, you are feeling pretty good already. And personally, this class is so nice if you do it in the evening, because the whole day you were sitting on chair, you're driving, you're always into this tight shape. It's really nice to open up before the day ends and you go to sleep. You really sleep well. I hope you enjoyed this practice. If you have any suggestion, questions, queries, if you want to understand more, if you want to handle other issues, please let me know. I'm waiting for your response. Thank you.